Are you looking for a simple way to improve range of motion and reduce muscle tightness for your clients? Well, in this video, I'm going to teach you exactly how to achieve that through muscle energy techniques.
So what is a muscle energy technique? Well, a muscle energy technique, or MET, is a gentle active technique used to relax and lengthen tight muscles. It works by asking the client to contract the muscle isometrically, meaning they push without movement while you resist. It's especially effective for improving mobility in areas like the hamstrings, hip flexors and neck. An MET is ideal when clients have reduced range of motion, postural imbalances or are recovering from an injury.
So when it comes to muscle energy techniques, which we're going to refer to as METs, the first thing you're going to want to do with every client is assess the current level of flexibility. So it's very similar in the sense of when we do a PNF stretch, so like a proprioceptive neuromuscular facilitation stretch. But what we're looking for at this point is the point of binding. So it's the first point you feel the muscle tighten up. So as I'm bringing this up, just about there, I can feel that. So straight away, that's telling me that there's going to be some kind of restriction here through the hamstrings. In an ideal world, we would want somebody to be at about 90 degrees. That would be considered a good level of flexibility. Anything beyond that point, for a general member of the public, isn't necessary. Yes, if maybe you're doing gymnastics or you're a dancer or whatever, you might want that increased level of flexibility. But for most people, we're looking for about 90 degrees. So the goal here is to get to that point. Okay, so we've just done the first test and we've discovered that there was some level of tightness in those hamstrings because we wasn't getting to that 90-degree point. So what we want to look at now is whether we're going to have to do the stretch on the whole muscle group of the hamstrings, or whether we're going to look specifically at the semitendinosus, semimembranosus, so that group of semis in the middle, or alternatively the biceps femoris on the outside. So in order to test these, we're going to bring the leg up. So here is the point of binding. What I'm going to do first is test the group of semis in the middle. So we're going to bring the foot here, and sorry, the whole hip, should I say, because as we bring that foot into external rotation, the hip will actually come out. And we're going to bring this back. And as you can see, the level of flexibility is pretty good there. So I'm going to guess that the issue is going to lie within the biceps femoris. So what we're going to do now is the complete opposite. We're going to bring it into internal rotation now. You okay? Mm-hmm. And we're going to bring it across the body, so that's tight. You can feel that. So already we can tell there's going to be tightness there. So the muscle energy technique I'm going to perform today is going to specifically be for this biceps femoris, but I will show you how to perform it on the group of semis and then also the whole muscle group itself. Okay, so we're going to perform that MET now on that biceps femoris on the outside of the hamstring. So it's going to be located just around here. So what we're going to actually do is, again, we're going to bring it into that internal rotation. And as we start to go across, I'm going to find that point of binding, which is here. What I'm going to get my client to do now is about 20 to 30% pressure. All I want you to do is push against my hand. So we're going to create an isometric contraction. The point of this is I'm not allowing them to push me away. I'm holding that resistance in the same spot. So when you're ready, we're going to do this for about 10 seconds. Can you push against my hand 20 to 30% pressure? Off we go. So you're trying to push my hand out towards me. And relax. And now we're just going to come across just a little bit more. So let me know when that feels a little bit uncomfortable. Which again, you kind of feel that new point of binding. So again, we're going to do the same thing for about 10 seconds. If you can push against me, 20 to 30% pressure. And relax there. And then we're going to bring this back across. Okay, so you can see the difference already. We was here to start with, and now we can get all the way over to about here. So what I'm going to do now is I'm going to retest. So we're going to bring this back up until I find that point of binding, which as you can see is now around here. So already we have surpassed that initial kind of 45 degrees that we were up to, and we're almost hitting that 90. So what you could do is two options at this point. You can continue with the MET on that biceps femoris, or alternatively, we could look at maybe doing it for the whole group instead. Okay, so hypothetical situation. Let's just say that you establish that both of the groups, so both of your semitendinosus, your membranosus, and also the bicep femoris. So the whole hamstring group was tight. The way in which we were doing MET here is, again, we're going to bring this up to that point of binding. So around there. Okay. What we're going to do now, exactly the same principle. Client is going to push against you about 20 to 30% pressure. You're going to hold it in that position. You don't want them pushing you away. That's not the point. It's not a strength contest. The idea is that we're both resistant against each other, okay? So whenever you're ready, 20, 30% pressure for me and pushing down this time. Again, we're going to hold this for around 10 seconds, both resisting against each other. And relax there for me. And what I'm going to do now is lean that a little bit further up. So about there, because if I go any further, the knee naturally wants to bend, okay? That's not the purpose here. So just relax a little bit. Okay, and again, we're going to go 20 to 30% pressure. Off we go, 10 seconds. So both resist against each other, trying to keep it stable in that position. And relax, deep breath in and out. And as you can see, we have almost achieved that 90-degree angle now in less than probably about 2-3 minutes, okay? So there's one other method that we can try now, and it's using reciprocal inhibition. So if you understand reciprocal inhibition, you understand that every muscle has an opposite reaction. So if the quadricep is contracting, the hamstring has to be relaxed. Likewise, if the hamstring is contracting, the quadricep has to be relaxed. So they're going to work in opposites. So what I'm going to get you to do this time is just contract your quads for me. Perfect. And again, just hold that. Again, a little bit of resistance against each other, but just focusing on contracting those quads. That's it. Keep them nice and tight because the hamstring has to relax now. And relax. And then again, we can get that a little bit further with it, okay? And that is how you're going to do an MET on the whole muscle group there. Okay, we're going to show you the MET for the semitendinosus and the semimembranosus now. We have already established at the beginning that it's not required for our client here because the level of flexibility is already good. So all we're going to do is we're going to do a hypothetical situation here because obviously don't want to increase that flexibility and make her hypomobile. So bringing it up. So again, we're going to bring it up, get you to bring that into external rotation now. And all you're going to do, and you can if you need to with this one, because obviously we're pulling across the body, you can hold the other hip to keep that alignment. Let's just say this was your binding point and we couldn't go any further. What I want you to do now is imagine you're pulling your leg in towards the middle, 20, 30%. That's it. And again, we're going to hold that 10 seconds. So we're getting those semitendinosus and the semitendinosus and the semimembranosus engaged now. And relax. And then that would allow you to bring that further every single time. Okay, and that's how you would do it for those two hamstring muscles on the inner thigh. Okay, so now you understand how to perform an MET. We need to look at some potential mistakes that can be made here. So let's just say we're going into the MET now. One of the biggest mistakes is that you go a little bit beyond that binding point. So I can just feel that kind of kicking in. The last thing we want to do is kind of force that hamstring up to the point that the client is now uncomfortable. So we want to avoid too much force. The other thing is misalignment. So I don't want to be sitting here kind of doing these techniques or just over here. So let's just say this one, for example. If all of a sudden I'm now pulling that client's hip over, there's going to be a misalignment and it's not going to be effective. So remember to hold the client stable so you can perform that technique correctly. Final mistake now is forgetting to retest the client. You want to know if what you've done has been effective. So always remember, after every single go, retest the client to see if that level of flexibility is improved. So we knew right from the beginning, we could only get to about here. The end of the session, you're going to retest, find that new point of binding to know that what you have done has been successful for the client.
Once you've completed the MET sequence, it's a good idea to follow up with light stretching and some active movement. This helps reinforce the new range of motion and stops the muscle from tightening back up.
Thank you for tuning into another video. If you have found this useful, please consider subscribing. We do drop new content each week. So hit that subscribe button, hit the bell notification to be notified every time a new video goes live, and as always, see you in the next one.